Today's lecture in anatomy and physiology is going to be on the cardiovascular system. The learning objectives are as follows. We're going to look at the structure of the heart, trace the pathway of blood flow through the heart, differentiate amongst the arteries, arterioles, capillaries, veins, and venules, explain what blood pressure is and how it's measured, and the disorders of the cardiovascular system. And then we'll also look at medical terms and abbreviations, of course, as we go through this lecture. We'll look at the roots, the prefixes, the suffixes, all the medical terms, and take a quick peek at the lymphatic system as well. So, without further ado, the cardiovascular system consists of the heart and the blood vessels. It circulates blood through the body, delivers oxygens and nutrients to cells, and carries waste products away from the body so they can be excreted at the lungs and in the liver and kidneys as well. But the one we'll be concentrating on is CO2 and oxygen exchange in the lungs. So here are the roots we will be looking at as we work through the cardiovascular system. I'm not going to bore you with reading through all those. So let me pick the right tool here. Hopefully this will do a nice job. Here's a schematic of blood flow throughout the body. And I am just going to basically trace a red blood cell from the left ventricle throughout the body and then back into the left ventricle ready to be pumped out again. So let's start right down here in the left ventricle. Left ventricle contracts, forces blood out in two directions. It goes superiorly to the head and arms. This is a capillary bed where the capillaries are about one red blood cell wide. The exchange of gases, oxygen from the oxygen-rich red blood cells, and picking up CO2 from the tissues after metabolism. So the deoxygenated blood-carrying CO2 is back into the heart, and here we are at the right atrium. Right atrium contracts, pushes blood down into the right ventricle. Right ventricle contracts, and blood heads out through the left pulmonary and right pulmonary arteries. In the lungs, again, another capillary bed. At the level of the alveoli, exchanges CO2 waste for oxygen from air that has been respired into the lungs. Now the freshly oxygenated red blood cell is going to head back into the left atrium from the left pulmonary vein and the right pulmonary vein. Right pulmonary vein will contract, and we're back into the left atrium where we started. The only difference with this lower part is once that left atrium contracts, those that don't go up into the head and arms go down into the inferior, or through the aorta, down into the internal organs of the abdomen, capillary beds there, and into the legs and the skeletal muscle. Collects the CO2 once again. Ooh, that got a little carried away. Up to the inferior vena cava, back into the right atrium, and now at this time the following the blood is exactly the same into the lungs and back into the left atrium to repeat the circuit. So let's take a look at the heart. It is between the lungs. There is the endocardium, which is the inside. Again, remember, endo lines the chambers and the valves. The myocardium is the muscular layer that makes up the heart wall, made up of involuntary cardiac muscle, and the epicardium is the outside lining. And then there is a pericardium, which is a fibrous protective sac around the whole thing. We have already taken a look at the atria. There is the left and the right atrium that contract and push blood into the left and right ventricles. Let's look at that. Right atrium, left atrium. And the ventricles are the main pumping parts of the heart. The pulmonary circuit is from the right ventricle into the lungs, and the systemic circuit is from the left ventricle into the rest of the body. Chambers of the wall are separated by septa, and the two circuits, once again, are the pulmonary and the systemic circuits. The pulmonary is to the lungs, and the systemic is oxygenated blood to the whole body. So here is a blown up version of the heart. Let's take a little closer look at this. Again, let's track through the pathway of a blood cell. We have the inferior vena cava and the superior vena cava, bringing in blood into the right atrium, and that actually disappears and comes up right there. There we have the right atrium at that point. Then it moves through the right tricuspid valve into the right ventricle, or the right atrial ventricular valve. And then in the right ventricle, after its contraction, it is going to send blood up through the pulmonary valve, pulmonary again being lungs, into the left pulmonary and right pulmonary arteries. Goes and undergoes oxygenation in the lungs, as we saw previously, and returns into the heart via the left pulmonary and right pulmonary, there they are, right pulmonary veins. Now the blood is in the left ventricle. The left ventricle contracts, sends the blood down into the, left atrium. Pardon me. The left atrium contracts and sends the blood through the left atrioventricular valve, or mitral valve, into the left ventricle. The left ventricle contracts and sends the blood out this way, out into the aorta, through the aortic arch. And let's just take a look at a couple other structures here. We will not worry too much about those at this point. So the carotid artery is the one that heads up to the head through the neck. Brachiocephalic is the one that goes into the arms. The ascending aorta is this large valve where all of the blood coming on the left ventricle heads. And let's look at some of these other. Apex is the bottom of the heart. Septum, or walls between the left and right ventricles. We have the epicardium on the outside, the myocardium in the middle, and the endocardium in the inside. And we have essentially covered all of it at this point. Okay. So blood flow through the heart, as we just said, right atrium receives blood, enters the right ventricle, and is pumped to the lungs. The oxygenated blood returns to the left atrium. The left ventricle, it enters the left ventricle and is pumped to the rest of the body. And the one-way valves, they are one way, except that there is a heart murmur, force the blood flow forward. And there are heart salves, thump thump, produced when the valves are snapping shut. So systole is when there is a contraction of the heart. Diastole is when there is a reaction. So when you're taking blood pressure, the higher number is systole. That is when the highest pressure is being produced by the left ventricle. And diastole is when it's relaxing and the blood pressure goes down and is preparing for the next systole. A heart rate is the number of times the heart beats in a minute. And the pulse is a wave of increased pressure as the ventricles contract through systole and diastole. So when the ventricles contract, they're stimulated by electrical impulses. They move through, starting from the top, the sinoatrial node. It spreads down through the atrioventricular node. There's an AV bundle that further spreads out a web of nerves over the cardiac tissue. There are bundle branches that move further down in the ventricle along with the Purkinje fibers. Let's take a look at those. In the yellow here, we have the sinoatrial node at the top. There is a wave of impulses that start at the sinoatrial node, head down into the atrioventricular node. We have the atrioventricular bundle, or the bundle of His, right here. There are bundle branches coming down through the septum of the myocardium, and the Purkinje fibers branching off at the very end. And that is a very rough schematic of the conduction system of the heart. So sinoatrial node, atrioventricular node, atrioventricular bundle, and the Purkinje fibers are the key terms to keep track of here. And the pulse moves from top, the sinoatrial node, to the bottom towards the apex of the heart and the Purkinje fibers. So here is an electrocardiography, electrocardiograph actually, that you get from electrocardiography. We're going to take a look at normal sinus rhythm. We have the P, QRS, T, and U wave. So let's take a closer look at those. The P wave, the heartbeat starts with the contraction of the right atrium. QRS is this big spike of the left ventricle, and the ST segment as we go through and start to get set up for the next wave of conduction through the heart. But this big spike is the one to keep track of, with the left ventricle contracting, with the smaller waves being the right and left atria. In the vascular system, you have arteries and arterioles carrying the blood away from the heart. Now, keep that in mind. Arteries always carry blood away from the heart. Capillaries are the smallest vessels, and that is where you have the exchange between the blood and the tissues, the waste products, and CO2 and oxygen. And veins and venules head back to the heart. Now, quick question. Do all arteries carry oxygenated blood? And do all veins carry deoxygenated blood? The answer is no, not in the pulmonary or lung circulation. In a pulmonary circulation, the artery heading away from the heart to the lungs, that is the only place in the body where an artery is carrying deoxygenated blood. And the pulmonary veins, in this case carrying blood back to the left atria, is oxygenated. Every other time in systemic circulation, veins are carrying deoxygenated blood back to the heart, and arteries are carrying oxygenated blood out to the tissues from the heart in the systemic circulation. So blood pressure is the force of blood against the walls of a blood vessel that we're measuring, generally with a sphygmomanometer. Learn how to spell that word and pronounce it. Now you know what a sphygmomanometer is. You wrap the blood pressure cuff usually around the brachial artery in the arm, and it is the pressure exerted against the wall of the brachial artery. They'll also use arteries in the wrist as well. And you measure both systolic and when the heart is contracting, and the diastolic when the heart is relaxing. So the arteries, I will not go all the way through all of these arteries. Now, what the heck? Let's start at the temporal artery, and if there's one that is important, I will point it out. The carotid artery carries the blood up to the head. The aorta is the main branch that is carrying blood from the left ventricle into the body. Mesenteric are going to the abdominal organs. The renal arteries are going into the kidneys. Gonadal to the testes in this individual. I'm assuming that's a man. Ovaries in women. And again, mesenterics. Iliacs going through the groin area. Femoral heading down the leg. Tibial, because it's proximity to the tibia, and pedis, if you remember that, for foot. And tibia, fibular, again, fibular or fibia. Ulnar, ulna, and radius have arteries associated with them. Brachial is the main artery going through the arm. Axillary, axillary is another name for armpit. And let's see. Yep, those are the main ones that you'll all want to pay attention to. So veins basically mirror the arteries carrying blood back to the heart in systemic circulation. Temporal fascia, the one in the neck is the jugular, so it's the jugular vein carotid artery going through the neck. The inferior carries deoxygenated blood back to the heart, and the superior vena cava is carrying deoxygenated blood and waste materials back to the heart from the upper body. Inferior, bringing it up from the lower body. Again, we have hepatic or liver, renal, gonadal, iliacs, femorals. Saphenous is a big vein that carries blood back to the heart. This is one that when you hear about people throwing clots from sitting on a plane too much or not getting enough, not moving around too much, a lot of times the saphenous is the one where that clot is getting formed and it breaks loose and ends up to the heart and ends up in the lungs and can cause death, actually. Tibials, radial ulnar. Those are the ones that are different from the arteries in the systemic circulation. So here are some terms you're going to want to take a look at and commit to memory. I've hit the vast majority of these during my lecture. Okay, so let's look at some clinical aspects of the circulatory system. Atherosclerosis is the fatty deposits within the artery. Here you can see the fat deposits narrowing the artery, making it harder for the blood to get through. High levels of low-density lipoproteins is predisposing to fatty deposits. Of course, smoking, if you're a smoker, stop it. It's the best thing you can do to improve both the length and quality of your life. Number one preventable thing you can do, of course, poor diet, high in fat, that we were talking about in self-care, in study skills. Inactivity, not getting any exercise, of course, those stress levels and family history certainly plays more than a small amount in contributing to atherosclerosis. Thrombosis is a blood clot. A thrombus is one that will cause necrosis and tissue death. An embolism is an obstruction that is most of the time caused by a blood clot, but other things can block the blood. You can have fatty deposits that will cause an embolism as well, but a blood clot is the most common one. An aneurysm is a weakening of the arterial wall. That is from, again, atherosclerosis, as we discussed in the previous slide. Malformations or weaknesses that you're basically born with and can also cause traumatic injury to a vessel, and then they will bleed out as well. So hypertension is when systolic is over 140 and diastolic is less than 90. Systolic when the heart is contracting, diastolic when the heart is relaxing. You can get an enlarged heart because the heart is working a lot harder to try and push enough blood through the narrow vessels. And think about it, if you have a nice wide pipe, it's much easier to move fluid through it. If you narrow the pipe down to get the same amount of fluid through that pipe, the pressure has to go way up. That's simple physics in this case. The coronary artery disease, or CAD, is from atherosclerosis. One of the first things that people will often feel is angina pectoris, or pains in the chest. You can take a look at electrocardiograms to see how the heart is functioning, how the heart functions under stress on a treadmill. You can actually take a look at it through angiography, and also another way to see the heart in action is echocardiography. Echo is a prefix referring to sound. The cardioarrhythmia, you can treat it with exercise, and nitroglycerin will release the smooth muscles around the heart so that it will stop hurting, essentially. And angioplasty, again, repair. You're going in and repairing the blood vessels and basically putting a balloon in there and expanding that artery. And in some cases, you can take the saphenous vein. Oftentimes, we talk about the saphenous vein and use that to put a bypass around an area that is too plugged up and is becoming useless and would not respond to angioplasty. So a heart attack or myocardial infarction, there is often pain in the stomach, above the stomach pain, and it will radiate out into the jaws, arms, and shoulder. Definitely get pale because there's not enough blood being circulated. Diaphoresis, or sweating, is a part of that. Nausea, difficulty breathing, or dyspnea. And when we're talking about heartburn, that is certainly related to the epigastric pain in our first bullet point there. So here you can see an electrocardiograph that is not nice and smooth. You don't see the nice dump. thump, thump, you see dump, dump, and then all of this craziness right over in this area is indicative of a heart that is just contracting willy-nilly. And that's what a heart attack will look like on an echocardiogram. And then you can also take blood samples and find creatine kinase is a real marker for muscle damage, including cardiac muscle. The arrhythmia can have irregularity of heart rhythm. Brady is a slowing. Remember, prefix is Brady. Tachy is faster. Again, we have the prefix tachy. And fibrillation is just kind of looks, I've seen videos of a fibrillating heart, and it basically looks like a sack filled with snakes. It's just contracting at random, essentially, and that's not good for pumping blood. And you can regulate this with a pacemaker. When we're talking about the atrioventricular node, the sinoatrial node, the Purkinje fibers, all of that, this is the system that the pacemaker is regulating, the conduction system over the heart. And when you are in fibrillation, you can use cardioversion via drugs or electric burst to stop that. When the heart is fibrillating, there are drugs that will reset. You can think of it as hitting reset on your computer. You hit reset on the heart, so it has a chance to get back into normal sinus rhythm. And when you're in CPR, you're talking about AED or electrical device. You know, the clear, put the paddles on the chest, boom. That's what they're doing, is instituting cardioversion via an electric current. And of course, CBR and ablation. Ablation is another word for just destroying tissues. In this case, if you have a part of the conduction system that is malfunctioning and not firing correctly, if you can go in and ablate it and get rid of it, oftentimes the heart will drop back into normal sinus rhythm again. Okay, so here you have a case study of an individual named CL who was asked to wear a Holter monitor. Which one of the following things was a Holter monitor for? How much he sweat, any arrhythmias, his blood pressure, or his respiratory status? Okay. The purpose of a Holter monitor is to record arrhythmias. And the two treatment options that he was given for his arrhythmias would be anticoagulants. And why would he get anticoagulants? The answer is that in an arrhythmia, blood tends to pool because it's not being moved smoothly. When the blood pools, you can get clots. So the anticoagulants will be against the clotting of the blood and will help prevent that. And then using ablation or getting rid of the malfunctioning part of his cardiac conduction system could also treat his arrhythmia. I guess I gave away the answer on the last slide. Let's look at some more heart diseases. You can have heart failure. Heart will not empty effectively, and you will end up with edema because the blood will build up behind the heart. It won't be moving through the pulmonary system and out the left ventricle, and so the fluid pools in the body, and diuretics can help get rid of that edema. In congenital or birth defects, you can have septal, you have a patent ductus arteriosus. There is parts of congenital or embryonic heart that there are bypasses that are done because the embryo is not breathing through the lungs. So there are shortcuts that are used, and sometimes those don't seal up correctly after birth, and you'll end up with things like patent ductus arteriosus and heart murmurs and coarctation of the aorta, or the again, what we're talking about, something not sealing up correctly. Rheumatic heart disease is from streptococcus infection, and they will settle on the valves, the tricuspid, the bicuspid or mitral, and the aortic and pulmonary valves can get affected by streptococcus, setting up camp on those and causing damaged scar tissue. And in the worst case, you can even have to replace that valve if it becomes too damaged. Varicose veins is one of those one-way valves that prevent the backflow of deoxygenated blood get blown out and allow blood to pool in the veins. You will get, these in the lower legs, certainly. Heredity, prolonged standing. Certainly in my profession as a pharmacist, we are known for getting varicose veins at an early age because of so much standing. And pregnancy, of course, all the pressure in the lower legs will contribute to varicose veins. And you can treat them with elastic stockings, or you can actually have them removed either with a laser, you can have them stripped out surgically, and you can use a chemical to actually burn them out as well. Cause tissue necrosis in the veins via chemicals. So phlebitis, again, we have an inflammation of the veins. A lot of times that is from infection. And you can have a thrombus, there we go again, or blood clot being thrown secondarily to phlebitis. So here are some key terms, again, to be aware of. Don't worry, hang in there, guys. I know this is a long lecture, but we're almost there. Okay, thank you very much for trudging through that with me. There are a lot of words and a lot of concepts thrown at you in this lecture. Please reach out to me. I'm more than happy to go over anything that didn't make sense, is unclear, or if I just smoothed over something that you were more interested in, that you wanted a further explanation on. Always just either talk to me during class time or shoot me an email. I'd be more than happy to help you out with any of that. Thank you very much, and we'll see you next time.